digital health innovation is very important. Currently, we are in the fourth wave of IT technology, information technology innovations in the health sciences. The digital health involves several aspects of technologies, not only artificial intelligence and machine learning, which is now revolutionizing the way that we do research and care of patients with stroke, not only with stroke, but also with other conditions, but also the way we acquire data. For example, the data until the third wave was acquired being hospital-based or in health centers. Now we can acquire data in wearables, for example, your iWatch, your telephone, via telemedicine. You don't need to be centered on a specific health center. And this is very important because we have now a pool of data, which is now called big data, which is defined by a high volume of data with a high velocity of production of data, with a veracity of this data. And it's being able to be analyzed in a ways that traditional statistic methods are inferior to analyze than the normal, than the new AI and machine learning, which is a kind of AI analysis. It has been increasing during these past few years, especially in the past 10 years or so, the amount of research that has been used in AI and machine learning to predict outcomes, not only in neuroimaging, for example, in my area. It's easier to use machine learning in neuroimaging because imaging is easier to put in mathematical ways. But not only that, predicting outcomes such as mortality, recurrence of stroke, functional status after stroke, all of these outcomes are more easily predicted, or in more feasible and more accurately predicted using the AI and machine learning methods than for example, regression, the classical regression techniques. There are more and more works and research has been doing comparing these kinds of methodologies, and the AI has been increasing considerably. And I believe that it is going to be the future, not only in research, but also in practice. Of course, in practice, we'll have some barriers, mainly transporting what you have on the table of research to the point of the professional that is attending the patient. He needs to be acquainted with the technology, but also the way we educate the health professionals overall, because we are not accustomed to these new technologies.